Hi, it's Zoe Brooks here on April the 13th, 2014, bringing you a review of the fundamentals of lab quality control. Clinicians depend on lab results to reach the right diagnosis and select the right treatment for patients. Their thought process is, I'm ordering this test to help decide if the result is below X, I'm going to think A and do this. If the result is between X and Y, I'm going to think B and it doesn't require any action. If the result is above Y, I'm going to think C and do something different. Good lab results will let the clinician reach the right interpretation, decide on the correct action. The outcome will be that the clinical risks and costs are as low as they possibly can be. However, if the lab results are bad, the only reason that bad results are reported is if A, the instrument produces a bad result, and B, the QC fails to detect it. Quality control fails to detect a clinically significant error. If your QC is ineffective, then the wrong results are reported. All of the decisions and action are inappropriate from that point, and the outcome is that clinical risks and costs escalate. Lab errors impact patient care. If your method has zero bias and good precision, then you will be able to correctly categorize the true positive lows and the true positive highs with a minimal amount of overlap. However, if the method has a positive bias, you're going to see people who are actually low falsely appearing to be normal. And at the high end, you're going to see patients who are actually normal appearing to be falsely high. False positives at the high end will be prescribed treatment and follow-up tests that they do not require, where the false negatives at the low end will not receive the treatment that they do require. A similar but opposite thing happens in the presence of negative bias. You'll see false negatives at the high end and false positives at the low end. People who are considered negative when they're actually normal. A similar thing happens if the imprecision of your method increases, if the standard deviation increases. Now you're going to see a greater overlap. You'll get more false negatives and more false positives at both ends of the spectrum. This is why you perform quality control every day, to detect clinically significant changes in method bias or imprecision. You can make sense of all these numbers with one